Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Ever notice how your dog or cat suddenly hesitates before jumping on the couch or walking up and down the stairs like they're 100 years old? Many pet parents might assume that it has something to do with aging, but that's not always the case. Today, we're talking about orthopedic issues in pets, which usually involves things like the hips, the back, and the knees, and everything in between. We're also here to answer your other pet-related questions on this episode of Ask the Doc, No Appointment Needed. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Joy Carter, a doctor of veterinary medicine, and today we're focusing on any and all orthopedic issues your pet may be experiencing. All right, let's dive right in. Our first question comes to us from Pablo, who reached out to us through our website, allhealthtv.com. Hi, Dr. Carter. I got a German Shepherd puppy a few weeks back, and I heard that hip dysplasia can be common in this breed. Can you tell me what it is and some symptoms of it? All right. So, Pablo, this is a great question to kickstart everything off. All right. So first of all, hip dysplasia is one of the number one, I guess I would say, kind of orthopedic disorders that we do tend to see in veterinary medicine. Basically, what it is when the hip joint does not kind of fit into the hip socket properly. Okay. It is more common in your large breed dogs. In particular, German Shepherds are large breed dogs. We can see it in breeds such as Golden Retrievers, Labradors, Pit Bulls, Rottweilers, Dobermans, any of these large breed dogs. Okay. Sometimes it can be evident when they are very young, and then sometimes they don't have issues until they start to kind of get older. It is kind of a little bit of a genetic disease in the sense of that certain breeds are predisposed. There definitely are some environmental factors, I would say, too, that can also predispose pets. The big thing would be a pet that is overweight. Certainly, you can tend to see them have hip dysplasia more severe. The more weight that you have on, the more stress you're putting on your joints and on your bones. Basically, what kind of happens in hip dysplasia is you normally have your femoral head, and that fits into your hip socket. Okay. A lot of times that femoral head and neck gets very thickened, and it should normally kind of fit in the hip socket like this. Okay. And be a very tight fit, but sometimes it won't be a tight fit. And then the bone should be very smooth. And sometimes that bone is not smooth. What that basically does is it just causes basically bone on bone to kind of rub together. And then that makes, it worse, and it predisposes them to developing arthritis. If it is detected when they are young, there are some procedures and things that can be done. Usually those types of surgeries need to be done by a boarded surgeon. I think there's something called a triple pelvic osteotomy. You can certainly sometimes, if it's one, or if it's both hips, you can do something called an FHO, or a femoral head and neck osteotomy. That's where you basically remove the femoral head so it no longer can rub in that joint. If it's not severe and say like it's noticed later on in life, there definitely are some newer pain medications, anti-inflammatories, joint supplements, and just making sure that you keep them at a good weight that can certainly help. But if you have any concerns, definitely talk to your vet. Some breeders will do kind of testing on the dogs that they breed before you get a puppy to kind of rule them out from having hip dysplasia. There's a couple of like different types of x-rays that they can take and kind of certify them to be kind of hip dysplasia free. Doesn't mean the puppies can't have it, but it's definitely a lot less likely. So that may be something that you want to look into if you're getting your pet from a specific breeder. All right. Our next question comes to us from Ruby, who reached out through our Facebook page. Hi, Dr. C. I hope this never happens to my pet, but if a dog or cat breaks a bone, how do you fix it? Do they get a cast like we do? All right, Ruby, I hope this never happens to your pet too. But before I talk about that, let's talk about 5 ways we can keep your pet's bones and joints healthy. All right. So just talked about this in the last question. First thing is going to be maintain a lean body weight. Just like it is in humans, the heavier your pet is, the more likely they are to have problems, the more stress that puts on the joints and on the bones. Another thing would be kind of regular low impact exercise. Now, I know that's not possible for every pet. There are some dogs that are working dogs that do have, very high impact type of exercise that they do. But I would say most dogs that are owned by most people, we don't need to be putting them through anything excessive, especially the small breed dogs, guys. They are known for wanting to jump up and down off the bed, off the couch. Okay. It doesn't seem like a big feat. They do it, they seem completely fine. But if we were to do it as a human, that's like sometimes us jumping off of the first story. Okay. And if you do that repeatedly over time, it certainly can have, issues with your back and with other joints. So if you do have a small breed dog and they do like to get on a very high couch or a high bed and jump off, get them a ramp, get them steps. They have all this stuff out nowadays so they don't possibly injure themselves. Okay. Another good thing is just a healthy, balanced diet. Okay. Doesn't have to be the most gourmet, the most fanciest food that is out there on the market. There's a lot of good quality food brands out there. Do your research, guys. Just want them on a good diet. Supplements are also important. Just like we can take supplements for joint support, dogs can take that too. So quite a few brands out there. I don't have any in particular that I prefer over the other. I think it's more a personal preference, maybe what your veterinarian carries, but most of these supplements are going to have glucosamine and going to have chondroitin, just like what we have in the human supplements. All right. And the next thing is going to be routine veterinary checkups. Okay. If your pet is starting to have any mobility issues, okay, getting them checked out by a vet first is definitely the way to go, okay? Because if they're starting to develop arthritis, there are things that can be done in the very early stages to hopefully keep it from progressing more rapidly. If you wait till it's so bad that they can barely move, sometimes we're limited on what we're able to do. And unfortunately, I have had to, euthanize pets because of severe arthritis, because their just quality of life was so bad. All right. So let's get back to your question, Ruby. So technically, yes, you can cast, a fracture, but it depends on where the break is, what bone, and if the fracture, if what we call is displaced, like the ends of the bones are not together. Okay. And it also depends on the age of the dog and the weight of the dog, different things like that. But also, just like in human medicine, you can actually fix fractures with pins, with plates, with screws. And actually, here's a picture right here of a fracture that happened in a dog that I repaired a couple of months ago. So this is what's considered a distal radius ulnar fracture. So it's basically this part of your arm in a human. And you can see in the next picture that we're going to put up that I actually put a plate and I put screws in it. Okay. Typically, when you do put plates, when you do put pins, screws, things like that, they don't need to be removed. Sometimes in humans, they remove them. Sometimes they don't. Same thing with dogs. We can remove them later on if they are causing issues, but a lot of times we're just going to leave that in. All right. So I hope this never happens to you, Ruby, but just know there are definitely surgeons out there that know how to fix fractures if it needs to be repaired surgically. Okay. And if anything happens like that, first going to take your dog to the vet. They're going to want to do x-rays and then they're going to let you know what the recommendations are. All right. Okay. So we got another question, and this is from one of our Facebook viewers. Okay. And this is going to be from Dominique. Hi, Dr. Carter. I have a 2-year-old Pomeranian that occasionally won't put weight on her back leg. My vet said something about a fluctuating patella. At least that's what I think he said. What is that? All right, Dominique, is actually luxating patella, but I could totally see where you get the confusion. Okay. Luxating patella is when your patella, also known as your kneecap, okay, that's in your knee, can move in and out of the joint there. All right. In particular, in animals, it tends to move medially, which means it tends to move to the inside of the leg. This is very common in our small and our toy breed dogs. Pomeranian is a really big one, Chihuahuas, Shih Tzus, Malteses, little toy poodles. Any of those breeds are the ones we tend to see it in. It typically is kind of a genetic disorder, okay, because it is more common in certain breeds. And a lot of that has to do with what we call the way kind of the conformity of their legs, I guess you could say. Okay. Dogs' legs are not all just straight up and down. Certain breeds kind of, they can bow a little bit. And with that, that can cause it to where the patella just doesn't sit in this groove. So it's something called the trochlear groove, or might be called the patellar groove. That's where your kneecap sits. And if that groove is very shallow, okay, for whatever reason, then it's more likely that that kneecap will move in and out. Now, we grade patella luxations 1, 2, 3, 4. Obviously, 1 being the mildest and 4 being most severe. I would say most dogs are going to have a grade 1 or a grade 2. Your more severe cases are going to be a grade 3 and a grade 4. And that is where the kneecap, the patella, is out. It is not in that groove that it's supposed to be. And it will go back in, but then it just kind of basically pops right back out. There is surgery that can be done to correct this, okay? Majority of dogs who have a low grade luxating patella, a grade 1, a grade 2, as long as they are not having issues and are not lame, usually surgery is not needed. Okay. Sometimes we'll put them on joint supplements just to help with the less likelihood of them developing arthritis. But your very severe cases, your grade 3, your grade 4, these are the dogs that definitely are hopping around on one leg occasionally, that are obviously having trouble going up and down steps, jumping, things like that. There is surgery that can be done. And basically what they do is they go in and they kind of deepen that groove that's in the femur, okay, that's underneath the kneecap. And a lot of times they will put a little pin in the kneecap to also hold it in place. I have seen dogs had both knees done at the same time, and they actually recover really well. I think that is going to be surgeon's preference. If you have a dog that has bilateral, which means both knees, if they do one at a time or if they do both at a time. So I would definitely recommend, Dominique, if your little Pomeranian is doing that, typically we can diagnose it on exam. Okay. So take your dog to the vet. We can usually just diagnose on palpation. We can feel that kneecap popping in and out. A lot of times we will want to take x-rays too. Okay. Reason why is we want to make sure there's not anything else going on in that joint or with any other bones that could also be contributing to why your pet is kind of not wanting to put weight on that leg. All right. So hopefully that's not the case, Dominique, but if it is, please know that there are things that can be done with or without surgery to help correct this or basically help your pet be better. All right. Our next question comes to us from Kiefer, who just visited us on Insta. Hi, Dr. Carter. I'm looking into getting a Scottish fold kitten, but I read online that there's a bone disorder that they are predisposed to. If this is true, and if so, what is it? All right, Kiefer, sit down, take a deep breath. It's going to be okay. But the answer is yes. Okay. There is a bone and cartilage disorder. It's called osteochondrodysplasia. Sometimes we'll abbreviate it as OCD. Okay. That these cats are predisposed to. Basically, what it does is it affects the development of cartilage and bones. Now, with the effect of, the development of cartilage in the ears, that is what gives these Scottish folds that cute little folded ear appearance that everybody wants. But the bad thing is that some of them can also start to develop the disorders of the bone. And it basically causes pretty severe deformities depending on how severe the case is. There is not a treatment for it. All right. If the pet starts to develop it in the bones and in the joints. If it is not very severe, definitely supplements, pain medications, anti-inflammatories. Occasionally, there might be something surgically that might be able to be done, but that's going to be a last resort. If it is severe, sometimes there is nothing that can be done. And unfortunately, in some very severe cases, there are reports of kittens or cats having to be euthanized just because their quality of life is so bad. All right. It is considered, I think, what's called an autosomal type of trait, which means I think they only kind of need one part of the gene. They don't need both to inherit it. I think cats that do get very severe cases are one that have both copies of this gene. I know these cats are really cute, and obviously I have friends and people that I know that have them. I think the best thing to do is just to do your research very good, and just understand that you are getting a breed that can be predisposed to, genetic disorders, and keep that in mind. Obviously, I feel like with cats, we've got so many, just like with dogs, we got so many stray dogs out there. So we got so many cats that need to be adopted. I'm not a really big advocate on buying a purebred cat, but I know some people are. But I think, if you decide to get a purebred cat, you've got to be aware of possible genetic problems, and you got to be aware of the consequences too. So hopefully, Kiefer, that doesn't happen if you decide to get a Scottish fold. If you're kind of like, I don't know if I want a Scottish fold now, go to your local animal shelter, look online at rescues groups. There are plenty of cats and kittens out there for you to adopt. All right. All right. This question comes to us from Herschel, who reached out through YouTube. Shalom, Dr. Carter. We're thinking about getting a new dog or cat, so we're doing some research at the moment. As such, we'd like to know what breeds are most prone to orthopedic issues and why. Shalom, Herschel. All right. So I touched about this a little bit on some of the other questions. Okay. Your large breed dogs are going to be the ones that are going to be predisposed to hip issues, hip dysplasia. Also, those larger breed dogs and those more active dogs are going to be the ones that are more predisposed to what we call CCL tears. Basically, it's the same thing as the ACL ligament in the knee that we have in humans, okay, that they can obviously tear. Your smaller breed dogs, like I mentioned, the toy breeds, definitely the luxating patellas. Things like your French bulldogs, any of your brachiocephalic breeds, the breeds with the smushy faces, are definitely predisposed to issues with the spine. And then obviously your Dachshunds is going to be your number one thing. And as far as cats, like I talked about, the Scottish Fold is one, but now there's a new breed of cat out there. If you guys have heard of it, they're called the Munchkin cats. Okay. Those cats, unfortunately, are bred to be basically kind of like little small midget cats. Like they're kind of look like got the body shape of a Dachshund, but they are a cat. And those definitely, they have a lot of orthopedic issues that they're predisposed to. All right. No pet, is going to be completely immune from necessarily having any orthopedic issues, but there definitely are some breeds that I feel like are less likely. So best thing for you to do is do your research and then decide on what's going to be best for your family. All right. All right, we've got another question from our website. This is from allhealthtv.com. You guys should really go check it out. There is a ton of great information. And this question is going to be from Hoda, who asks, "Hi, Dr. Joy. My neighbor has an adorable pitty puppy whose wrists look like they were knuckling over. He seems happy, but could there be something wrong with him?" Hi, Hoda. All right. I know exactly what you're talking about when you mean knuckling over. So there is something you can see in some of the larger breed dogs is called carpal laxity syndrome. Basically, it is kind of a genetic disorder. And it is where kind of the wrist, okay, which is the medical term is going to be carpus, it kind of will knuckle or kind of bow over. If you guys want to see exactly what it looks like, get on Google, type it in, and you'll see some pictures. The good thing is it does typically correct itself, and it is not painful or harmful to the puppy. They just kind of look a little weird, kind of with their wrists kind of like this. All right. But it doesn't hurt them. Typically, it's usually we see it when they're very young and they tend to outgrow it a few months after that. Sometimes if it is very severe and it is causing some problems with the pet walking or everyday activities, I think there are some braces that can be put on to kind of help keep the wrist in a better position, a little stiffer in the meantime. But I would say the majority of cases that I have seen, I've never had to do that. These puppies are running around like crazy, like nothing's problem. They just look a little funny walking, and it usually resolves on its own. So it's nothing you need to do. So, but next time, if you see your neighbor, talk to him about it. I'm sure he or she will be glad to give you a little bit more information, or even your veterinarian. All right. So we got another Facebook question, and this is one from Petra. Hi, Doc. What role, if any, does physical therapy play in feline and canine orthopedics? Hi, Petra. What a great question. And yes, there are actually veterinarians and there are actually veterinary technicians who have specific training in rehabilitation and physical therapy. We're very lucky on a lot of this area in particular, that we do actually have rehab facilities for dogs. Okay. I don't have a certification in rehab. I certainly could get that, but I do have some friends and other colleagues that do. And rehab can be very important, definitely post-op in a lot of fracture repair cases. Just like I talked about, there's surgery for luxating patella. There can be surgery for hip dysplasia, different things like that. So just like in humans, when you have a major orthopedic surgery, your doctor is going to recommend physical therapy. That is definitely something that can be done. Obviously, physical therapy and rehab can be good for pets that already have arthritis, especially a lot of these back dogs. I don't know, you guys have probably seen videos of the dogs kind of swimming or walking in the red water treadmills. That is definitely something really good. There are certain veterinary practices that do kind of have a rehab facility associated with them. And then there's some that are just kind of standalone. So definitely if you have a pet that you feel like is maybe having some orthopedic issues, that may be something that you want to talk to your veterinarian about. Okay. Because it's definitely, there are a lot of benefits to that. Even acupuncture is something new that a lot of veterinarians are doing. And actually one of the hospitals that I used to work at had a really cool rehab facility. We had a indoor water treadmill. And then we actually had a pool outdoors. And I'm not going to lie, it is so cute to see the dogs doing the rehab. And even rehab is for cats. Okay. I have seen cats. I know everybody thinks that cats don't like water, but I have seen cats inside of a water treadmill. All right. And I definitely think there is so many benefits from it. I try and offer to a lot of my orthopedic patients that I see after repair, offer them the ability to go and get some physical therapy rehab, or actually give them instructions on how to do that at home. Because there's definitely some things that you can do as a pet parent and you can help with their recovery and things like that. All right, guys. So I wish I had time for another question, but it looks like this is going to be all for today. This is actually a favorite topic of mine. I recently started getting into doing orthopedics at the practice that I'm working at, and I am absolutely in love. I've been so grateful that I've had the opportunity to do so many fracture repairs and other orthopedic surgeries there. It's definitely very interesting. All right, you guys have a great day, and I'll see you next time. Bye.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.